Today, I and Dr. Ease will be reacting to this tweet on Twitter. Please, nobody should come for me from Twitter. I'm not your mate.
If you are reacting to a tweet from, then you should be ready to be dragged. If your views don't tally.
I'm undraggable because I'm seated with Christ in the heavens. You can't
wow, glory.
You can't drag me. I'm sorry. You drag people who live on the terrestrial part of the world. So, well, anyways, from Dr. Olawale Ogunlalo, says, what I earned as a medical doctor in 1 year, I earned it under a month as a content creator in the tech space. I love the last part. It says, I want to see what will make me practice medicine in Nigeria again. All right. So, really, Dr. Israel, what do you think about this particular tweet? Well, anyways, before we go, I want to show you something. Anyways, I don't know where it's on the thread, but I saw somebody writing here, passion or money driven. First of all, what do you actually think about that statement? I was actually offended by that, because the person trying to say, are you passionate about medicine, or is now money night drive you go do medicine? So
all right. And I love Dr. Olawale's response. It was like, go and use passion to pay your NEPA bill.
Twitter street is vicious.
No,
like
Twitter
it's not for the
ghetto. It's not for the faint-hearted. Like me. You know, today they love you, tomorrow they say people are dragging you. You know, and they say only the strong are immune to shukuchuku.
What's shukuchuku?
Shukuchuku, like attacks.
Yeah,
okay. Drugs and stuff like that. Anyway, so yeah, reacting to this, the first thing is this. There are some things that marked me when I saw this tweet a couple of weeks ago. The first thing he indicated was he was comparing medicine and tech.
Okay.
And then there was a time frame that was compared, which is 1 year and 1 month. And also, this tweet is directed specifically to Nigeria.
Okay.
Practicing medicine in Nigeria.
Okay.
Now, looking at the realities of practicing medicine in Nigeria, it's difficult. There are lots of challenges. First of all, there's the fact that doctors are not paid on time. The fact that doctors are underpaid. There's the fact that one doctor is handling hundreds of patients and all of that. So now, as a young guy, as you're growing, you might be passionate about medicine, but you might love medicine. But allow me to tell you that no matter how passionate you're about something, if you are not getting and looking at this, right, you realize that I don't know this guy personally, but a lot of people, they might not even want this affluent life of big boy life, spending money however. They just want to be comfortable, like be able to take care of their basic amenities. And I think I want to assume that that's the same point, because he referred to NEPA bill when responding to this guy.
Sure.
So it might just be that this guy doesn't want this affluent lifestyle of maybe private jet or like a Lamborghini or stuff like that. He just wants to be okay, pay his bills, take care of his family, take care of his parents, his siblings, make sure that his kids go to a very good school, they learn and stuff like that. So I don't see anything wrong with his tweet. In fact, I go with him. Well, just to say this here, a couple of months ago, I started attending a few tech spaces and stuff like that. I started considering.
Doctors learn that too. Doctors code. Doctors learn to bake.
I'm learning how to. I started learning how to code. Do 1 or 2 things here and there, because if you really intend on practicing medicine and medicine alone, especially in the Nigerian space, trust me, it's a difficult one.
Okay, I'm going to be showing us a video by Dr. Ali Abdal. I'm going to be showing it to Israel right now, and then we'll be back. So you're going to watch, I'm going to watch, and then we're going to be back. And this video is actually going to center on, like, why do we work? Like, maybe if we can answer this as medical doctors, and we can be able to put this tweet in context. Okay? All right, so we'll be back.
What is the purpose of work? And the way I see it, there's broadly 5 different things that we work for the sake of. The first one is money. We need to work to make money. The next one is having fun. The third one is helping people. The fourth one is some combination of like purpose and meaning and that kind of stuff. And the fifth one, which is a very sort of unsexy thing that we probably won't admit to ourselves, is social status.
All right, so Dr. Israel, so about the 5 things about why people work, like, is there any, which of them, like, would you say you chose medicine for? Is it all 5?
Well,
money, fun.
For me, helping people fun, a certain level of meaning, but not in its like sole purpose, but it's like I find that comfortable. And then there is the money part. I won't really say that because from childhood there's something I always told my mom, and it's that it's not what I study that is going to make me wealthy. You know, I don't know why I kept saying that, but you know, and then talking about social status, yes, it's true that back then medicine had this social status. Well, even at this point in time, there's this thing that, you know, when you introduce someone and yourself to someone, you say, oh, I'm a medical doctor, they give you some sort of you know, value or something like that. Yes. So for me, first of all, it's helping people, some sort of purpose and meaning, even though it's not in its entirety, but then there's also the fun part, because I love medicine. You know, when I was still a nurse in nursing school, it's very interesting that when we were learning how to insert cannulas, give injections, and you know, trying to pick veins and stuff, for me it was fun giving my hands to my my fellow students to learn, because for me it was like for me, like, my veins, like, I was really slim at that time, and then my veins were really visible. So it's like I just make a fist and then I give to them, and then they try.
Well, I don't know about what this guy is saying, but when I was in med school, like, I'm not pulling my shit. First of all, because I'm a fan boy.
I never love pulling
First
my
of
shit.
all, I'm a child of God. I cannot pull my shit. I'm sorry, I did just call all my classmates. But I can't pull my shit. I don't know what you think about that, but medical students and medical doctors watching this video, like, when we were in medical school, how comfortable? And there were those people who want to pull their shirts.
I wasn't comfortable pulling my shirt, but I still remember one day teacher told me if I don't pull my shirt, no class. And
that's the end of the class for me that day.
Well, I couldn't reach the whole class having to rework. I mean, like, I stood my ground, but at a certain point.
Did you pull your shirt?
I had to end up pulling it.
Ha! Confession on my channel.
It was difficult. It was very difficult. It was very difficult.
I'm sorry, classmates. We are all going home. We have all failed. I won't pull my shirt.
It was very difficult.
But I appreciate those who can pull their shirt. I'm sorry.
It was a very difficult thing, because she had to, like, demonstrate stuff. So
must it be
my
you?
chest. I don't know why that day she said it's either me or no one.
Wait, were there other people who were willing to?
Yes, people were willing to.
Please, let's come back to the discussion.
Let's stick to the discussion, because I wasn't. I felt so bad.
No. But at the end of the day, maybe because we were refusing, she was like, who will you be when you go refuse to?
Well, probably it's that, you know.
Anyways,
and I always refused though. So I think that day.
So that day she was like, you must do today. Well, thank God I was able to escape that. But let's skip that. So about the money pattern, I'm going to insert a clip from Dr. Phil. He was on this channel. He said there are actually people who study medicine for money, and then also for the part you say that helping people as well. I believe Dr. Phil also said something like,
now you have gone through school, having been equipped with knowledge, universal knowledge. You start practicing and you go into a system where people die cheap deaths. When I started doing my housemanship, I first of all started in a general hospital. Eddie, like, somebody comes to the hospital, cannula. They don't even have money to buy cannula. And when that happens, the patient is dead. And then I find myself writing lots of death certificates, and I'm like, I wasn't trained. I haven't spent 7-8 years of my life in medical school to be writing death certificates, especially for deaths that I think are preventable. Like, if this guy just gets probably normal saline, probably gets a quick intervention, it should be better. So, in as much as the financial part was there, but there was no joy in what I was doing, because I wasn't saving lives really. There was nothing. Like, people just died so cheaply, and for me, I felt this is not just what I want to do. Like, I'm not going to be happy doing this. And I began to think of other alternatives.
When he was practicing medicine in Nigeria, not practicing in the UK, one of the things that he didn't enjoy was that they really could not help people, because someone can die just because they don't have like simple equipment like cannula.
Yes.
So in that sense, if you really want to help people, like you
need money.
Yes, you can help people without being like a doctor or having the skill of like medicine.
Yes.
Like
of course, like philanthropists do.
Yes.
They give thousands of money and hundreds of thousands.
In a sense, a doctor may be able to save like one maybe patient or two patients maybe in a month. That's even like life-threatening situations. But someone like a philanthropist can save like that's an exaggeration, let's say like 5,000 people, like, because you can send your money to a foundation and then like maybe 5,000 people across the globe who have that disease. So rather than one individual doctor in one hospital dealing with like very few cases, a philanthropist with their money can reach all around. So like helping people, I feel like for me, I used to say that before to study medicine, but I feel like for now, like that's not really a valid reason. But let's not, that's another topic for another day.
Yeah, that's another topic for another day.
But I want to ask you, what is really like, because this post is about money. Let's not deviate, because he was not talking about fun, helping people, purpose and meaning, or social status. That's not what he was talking about. So what is really about money that would make these other 4 things make sense?
All right.
Because we cannot pretend that.
Yes, we cannot pretend. Here's the thing.
I love medicine. Like I love medicine, and then I cannot pay my bills. Like, what's the point?
That's the point. I think I was talking with a friend one time, and then he was trying to relate money and purpose and what you like doing and everything. And then he was like, we're having
was it you that sent me a post yesterday about they lie to us when they say love what you want and then it will give you
and then money will follow. I was talking with a friend about that, and then we're talking about what you like, purpose and stuff like that. And he was like, people normally say, follow
your passion,
follow your passion. Yes, not purpose, follow your passion and stuff like that. And then the money will come. And then it's like sometimes you follow the passion and then the money is not coming. You're so frustrated, you are throwing tantrums and everything and stuff like that. And then he was like, while following your passion, right, find something that is giving you income, even if you don't like it. Continue doing it to the point where your passion is able to give you income. Then you can drop this. Now, talking about money in this post, let's be honest, you can't have fun without money. You can't help people without money.
Maybe it means fun, like you love going to the hospital and you like drawing blood. He said it says like that.
Yeah, exactly.
You like the hospital environment.
But let's look at the fun in this sense, right? If you have money and you're paying how you want, or you have money, not necessarily from medicine, but you have money, right? And then probably you own a hospital. You can go to the hospital, do your stuff, and come in, stay there for 2-3 hours and walk out.
And I won't feel like, even if I like my co-workers in the hospital, even if I like the hospital men, if I don't have money, that like no go. It will diminish.
Of course,
at the point I will not like talking to everybody. Because I'll be stressed. No matter how much I like maybe procedures and doing all those stuff.
At a certain point, for example, like let's take a very classic example, right? You're conducting a procedure and then probably the night before your kid came back and then it's like that they said I shouldn't come to school tomorrow if I don't come with my school fees. Or probably your landlord just left you a notice in the morning, hey, you have to pay, or probably their bill spending. Like you're not going to concentrate.
But now I want us to like wrap up this video, like in response, like we agree with this guy.
Yes, I agree with the guy.
Then, 100%. But let's now talk about, like, there was a video that we did together, and I'm gonna put the question that someone asked about masters and everything, and this guy was asking me a question like, thank you for reaching out, like, and he was saying he wants to make a choice, something in digital management,
digital
tech and all those stuff. So
digital health, I think.
Health, yes. So maybe we're talking about, he probably is looking at this point or this view. Many doctors are open to like other choices aside even money,
health,
maybe
informatics,
and all of those stuff. So what is that point where it is not madness, where you just run out of clinical medicine for nothing? Because I want to like put that in place, that no matter what you think, like this guy must have invested in his tech knowledge. He's not a mediocre tech person, I'm so sure, for you to make money.
Well, just to cut it short, the interesting thing with tech is this, right? From once you start learning the basics and getting a grasp of the basics, right, you start making money. I mean, even in Nigeria, that someone who studied medicine and who has been practicing for a couple of years does not make. That's the interesting thing about it. It's really surprising because last year, towards the end of the year, I really took time. I started checking the stuff, and I'm like, whoa. And then the beautiful thing is that it's very easy for them to get remote jobs. So you see, imagine in Nigeria, you're working for a company in the US, in Canada, in Estonia, you're working for these companies, and then it's like it's easier for you. So Really, the guy is not crazy.
But if everybody runs out of medicine, who will treat our mom? Who will treat our dads? Who will treat our brothers and our sisters? If everybody becomes
Now,
tech.
here's the thing. If you really want people to stay in medicine, right?
Okay,
have to make
let's not go there.
living conditions better for doctors.
Okay, let's not go there.
And that is why I stand.
I get.
There are people who are really passionate about medicine. They really don't want to do anything else other than medicine. But then, at a certain point, you will not live on the street and be doing medicine now. Like, literally, like, they're basic life demands.
Yeah.
Yeah, they're basic demands for life. And I don't know.
Well,
I hope my mom doesn't come for me when she sees it. Yes, she's like, my doctor son wants to run away.
Anyways, my mother does not hesitate. Every day she calls me a doctor. It's okay, it's fine. Like, it's okay, mommy. So, but at the end of the day, I feel like doctors should right from time explore their life holistically. Like learn tech, learn content creation.
I think that's also one of the area where doctors are. I don't want to say missing it, but it's like medicine can be so demanding,
but
that
I
you
think
miss
it's
out on other
important to create a little space to learn something here and there. But you actually can to learn at home. You actually have
of course that is
a few hours to learn the keyboard, to learn the guitar,
that is why I
really
songs, appreciate the fact that I studied medicine in Ukraine.
Let's not talk about Eastern Europe. Let's just leave that part at the end of the day. Let's just leave it. But I think wherever you are, you can actually create time and learn and start from the beginning. Yeah. And one thing I don't want people to do is to make hasty decisions. Like just because one person is telling you now they left tech, medicine to tech, and
does not mean it's for
less than in this particular space. Please, let us appreciate that some stories are not told in full, and of course,
but also. Before making the transition, you need to realize where is the tweet? Where is that tweet?
Check your phone.
Just hold on. There's something I want to point out in the tweet. He was like, what I earned as a medical doctor in 1 year, I earned it under a month as a content creator in the tech space. Now, let's be mindful of this. He must have mastered his craft. So, most likely for the last year or the last 6 months, he has been mastering this craft of doing this and doing
yes.
So before he transitioned,
and that's what I want us to see, the behind the scenes.
Yes,
I'm encouraging people to to make transitions if they want. I'm not going to judge you if it's for money. Like if it's just for money's sake, like please, like enjoy yourself. And if it's for passion's sake as well, which I would actually really more sponsor. Like I really love to do this, do that. But at the end of the day, please don't make a rash decision. Ali Abdal has left clinical medicine to become a YouTuber. Come on, Ali Abdal was on YouTube for 8 years, I think, minimum. I'm not so sure, before he made that transition. I don't know about Dr. Olawale, how long he learned tech before he made that transition. So I know that it's so easy for you to sit in your bed, second year, third year, fourth year, fifth year, sixth year, or young medical doctor to be thinking tech or something. But just make sure that you have a well-rounded decision, and that
you also have good savings, because for one person it might just click immediately, like bam, you know, and for you it might take some time to click. So don't just wake up and
and nothing is easy.
Yes, it's not as
like
easy as
don't think that you leave medicine and then you run to go and be tech guy, or you open YouTube channel like nobody watch your video. You never still get 10 views since this thing. Like I'm telling you about the YouTube street. I'm advising you. You just think it's not be 1,000 subscribers and 1,000 watch hours have been monetized. Man, not everybody monetizes making good money. You know, it takes time. To be able to earn money. So don't think that, like, don't run to do something else because you think that it's going to be easier. Just be well informed. So I totally agree with this tweet, and I don't agree with the person who says passion or money. I don't know. Passion is not going to pay his NEPA bills, like he said.
That for me, that was the most epic response. Can't pay.
So, anyways, this is just to advise people, like there are alternate forms of medicine, but be very careful as you make that transition, and also be bold. Thank you guys for watching, and please do like if you like this video, like this content, share. We're on our way to 2K. Don't sleep on this content. God bless you, and let it be that it was on my channel that Mr. Israel Police shit was revealed. Anyways, bye guys. You go and do devil sign, please.